Hello again, Airdrie. I want to take this video as a chance to discuss something that wasn't initially part of my platform. I had picked three pillars that I wanted to talk on, and this initially wasn't one, although it does tie into mental health a little bit. So, which is one of the ones that I did put some focus on, but thanks to being educated by some dedicated paramedics, I've learned a few things that I wasn't aware of before, and I'm glad that I do understand a little bit better now. So, Airdrie, let's talk about the EMS crisis that we are facing. A little bit of background from what I've been able to understand based on some fact checking and looking and listening to these paramedics and going through some old stories and some old information that I found as well. So some background here is that back in 2009, EMS went from being a municipally directed initiative to provincial. Since then, our coverage has been slipping slowly but surely. This isn't a factor of just the pandemic, although that certainly hasn't helped situations, obviously, but it is something that has been ongoing for quite a while now. Based on this and what's happening, we are seeing extended wait times occurring as far as from the time that you call requiring an ambulance and the time that you're actually receiving care. And in a city that currently doesn't have a hospital, I know that's a hot spot with the fellow citizens of Airdrie here, but currently our scenario is we don't have one. So having that timely access to an ambulance is even more important. There are several reasons that play into this, and I'm by no means an expert. I am just learning as much as I can, as fast as I can, thanks to these paramedics sharing this information and these facts and figures and all of the data that goes behind it. But some of the factors are there's a shortage of staff. A big factor is that Airdrie ambulances are currently or constantly serving other communities outside of Airdrie. There are four ambulances that are dedicated to Airdrie, and they are very frequently being sent out to service other communities. Paramedics having to wait in hospitals to transfer the patients over for hours and hours. I've heard upwards of 12, 15 hours sitting there waiting to transfer the patient over, and that's time that they're not out on the road servicing other people who are having emergencies at that time. The fact that everything is angled towards Calgary. And what I mean by that is that the way that the system works is ambulances are being called out to their closest emergencies as they're being available. A lot of times that means that rural areas such as Airdrie are servicing Calgary. So for instance, this year, approximately 50%, or actually I think it's even more than 50% of the time, Airdrie ambulances have been actually servicing emergencies in Calgary. So what does that mean for other rural areas and for our service? That means that other rural areas, around us, Crossfield, Carstairs, those are sort of areas, their ambulances might service an emergency here in Airdrie, and it collapses towards Calgary, per se, being the major metropolitan area that has the most population and therefore the most emergencies. So it kind of becomes this collapsing circle almost of services, where then you have other communities who don't have their ambulances there and available. So other communities are servicing them. And as you can see, that snowballs into a situation where wait times to receive an ambulance is increasing over and over because they're never where they need to be to actually service emergencies there. And that's a huge problem. Like I said, especially in a city like ours where we don't have a hospital, so those ambulances become even more critical to that immediate care in a life-threatening emergency situation. On top of that, there's also a reduction of service. A basic life service or life-saving services versus advanced life-saving services. And that is tied to the paramedics that are actually available in the ambulance. The advanced paramedics have more years of training. I think it's 2 more years of training. And as such are able to provide extra services. They're able to administer additional drugs in the situation. They can perform different techniques that might be part of saving your life if they come and have to visit you. Hopefully they don't, but it's going to happen. And because we have these paramedics, that the short staffing, that there's a lot of times that our Airdrie ambulances are reduced to BLS, basic, because they don't have an advanced paramedic to run with that crew. And that can be a huge difference in what happens in the level of care that you have in that immediate time when you have that emergency, because we never know when we're going to have an emergency. They happen. I can speak from experience. I've had one happen recently. And so having that shortage of advanced paramedics available to staff our ambulances is a huge problem as well. So what can we do about it? And that's where I kind of tie this into my platform per se, or not even my platform. It's something more important than that. It's something that I am going to work towards helping, whether I'm in council or not. Obviously, it's a lot easier if I am in council, but I'll find ways to support and help the situation, even if I'm not. Because it's a provincial thing and not a municipal thing, I feel that what we need to do is we need to work with the other rural governments, the other cities and towns in our area, to put pressure on the province to fix this issue, because it's not our issue to fix. It's the province that has this control. So we need to show them that we want change. We need this to be fixed. We need strong advocacy from our municipal governments. We need to take those facts and those figures and those numbers that AHS frequently doesn't share, but they are available. If you actually look, those numbers are publicly available, but AHS has a habit of not, from what I've seen, not touting those numbers because they don't speak well for the level of service that we're receiving. So we need to put these numbers, these facts, these figures into the limelight, put pressure on the province. The system isn't working the way it's intended. We need to fix it. Also, we know, based on what I was saying earlier, that we have excellent EMS personnel in this city that are willing to fight arm in arm with council to get these results. They have put on town halls sharing this information. We need a strong council that is willing to work with these paramedics, work with these people who are willing to stand up and try to fix a system that they know is broken. So I want to be part of that strong council, that strong advocacy that is going to put that pressure on the provincial government and fix this problem and get results. As citizens, we need to know that EMS will be there in our worst moments. Just a quick story. I understand this. I've had this happen in the last year where in the middle of the night, I had a situation where I had to get my wife to call an ambulance. And I know based on what I've learned that I had an ambulance that had an ALS paramedic in there because I know of the care that I received, the drugs that I was able to be given in my situation are part of their purview and would not have been available if I'd had a BLS paramedic only at the time. So based on the education I've gotten, I know that I got that. And I know that I actually received an ambulance in a reasonable amount of time. So I was lucky and I wasn't affected by these issues, but it really puts into light the fact that I went to bed that night not knowing that anything was going to happen. And there I was at 2-3 in the morning having to have an ambulance called, and was so lucky and fortunate that they were there and available when I needed them. And, happy story, happy ending to the story because, well, obviously, but it does put into my mind how important this is. Not that it wasn't before, but when you speak from personal experience, it really solidifies it in your head. So this is something that I think is very important, needs to be dealt with, isn't a municipal issue per se, but it's something that we as council need to fight towards with the province and other communities to try to get this problem fixed so that it doesn't turn into a situation where people are not having the services they need when they need it in those worst possible moments. So I wanted to add that in there because I think it's very important that we bring it into the limelight. So that's what I have to say about EMS services. And I guess one last side note, I mentioned at the beginning that it did tie into mental health, where which is something that I'm very, very strongly pushing towards as part of my campaign. You might not realize it, but a mental health issue, because people don't think this way sometimes. I think about it this way because, again, I've been there. I've seen it happen. A mental health emergency can quickly become, or a mental health crisis can become a EMS emergency if things escalate to that point. So having EMS there and available to help de-escalate these situations if a mental health crisis gets to that point is also critical. So having those services available in a very timely fashion aren't always just about those life-saving measures that we think about. You have an accident, you have some sort of internal health problem. It also ties very strongly into mental health as well, because it can escalate to that point where a mental health crisis becomes a medical emergency. And we need to know that the EMS and the ambulances are going to be there and available to support that when we need them. So unfortunately, again, I talk from experience on that one, but it's something that I understand all too well. But anyway, with that being said, take care, keep getting involved, keep getting informed out there, and we will talk again soon.